A cheerful heart is good medicine, Proverbs 17:22. So today was the last day of the first week of my therapy, and I have survived it very well. I've had great support, of course. At the beginning of the week, both my husband and my daughter, I have two kids, but my daughter was able to be there, and then she had to fly home, and we got to finish off the week with my husband, and it was a good session. I told you about the mouth splint hurting the front of my teeth here. It's just hard to use a big mouth splint when you can't open your mouth so wide, and that's because if you haven't seen any of my other videos, I've had the parotid gland removal, total removal. Some people, I guess, might not have had the surgery prior to the radiation therapy. So it just makes it hard, as you can see, with my mouth working and not working, to open my mouth wide enough, but I get it in there. And then the problem is, I think, because the facial mask is so form-fitting, literally, when I come out, I have a grid mark on my face, all the little X's, from where it's so tight on my skin. So I think it's the tightness pushing down on the splint that already is uncomfortable. So the technicians that do put me in and actually run the therapy asked my doctor what could they do to help. And he said that before my next session on Monday, they will actually use a hair dryer to heat it up, and it will be pliable, and then they're going to pull it out just a little smidgen to give me a little less pressure down on the mouth splint. So I will let you know Monday if that has worked. But if not, I just appreciate them listening to me and deciding that if there's a way to relieve a little bit of the pain, that they're willing to go to bat for me and ask, and the doctor was willing to let that be done. So I am very pleased and thankful for that. Now, the session, other than that, was exactly the same as the rest of them, and because they have given me such good pain management for this week, I really didn't have any pain, real pain. I will say that I'm feeling maybe just a smidgen, a little bit, more tired. I slept longer today, which is good, because it's if you're like me, there's just a little anxiety going on, and it's hard to get your mind to totally rest. But now that I've gone through a week, I was able to sleep like a baby last night. So I got a lot of sleep. That was awesome. But I still felt a little bit tired. Part of it is, sorry, I'm scratching again. Part of it is that I waited until just the last few days to really give up the carbonation, which is my main source of caffeine, Diet Cokes, because the carbonation is not going to feel good in my stomach. I'm suffering with a little bit of acidity, so I certainly don't need to add the carbonation to that. So today I drank pretty much all water, which I think a lot of people would be going, yay, that's better for you anyway, of course. But I think I'm suffering just a little bit from caffeine withdrawal and feeling a little tired. At lunch I did drink a little bit of sweet tea, and it was so yummy. But back to the radiation therapy and how it's going. I will tell you one more thing about it that I didn't mention yesterday. If you can see, this is a delicious bowl of grapes. And I bought them and was chowing down on them yesterday, and they were so delicious. I sent my daughter a picture and said, best grapes ever. And they're so juicy. And they're my favorite colored grape. I don't know why, but I like the purple ones the best, or better. I guess there's only maybe two different colors. And they were so delicious and so juicy, and I was just eating and eating and eating. I wish I'd eaten a whole bowl now, because that was like at 10 o'clock yesterday morning, and then we went for my radiation therapy, and I came home and grabbed the bowl and started plunking them in my mouth, and they were very sour, and I'm very sad. So I tried different parts of the grapes, because they're in two big arms. So I tried top and bottom of each one, and I still had the same effect. So I took them to my husband. I said, taste this grape. How does it taste? And he said, fine. I said, well, taste another one. Get from a different side. He said, fine. And then he said, because he's reading and he knows a lot more about what's coming my way than maybe I do, he said, well, Robin, I hate to tell you, but one of the ways in which your taste will change throughout this therapy is I think he said thin-skinned fruit, and of course that would qualify as a grape. So I'm sad that I'm not enjoying those grapes anymore. So I've decided, one of my sisters is coming in this weekend, and I've decided that I'm going to have a chocolate fest Saturday and Sunday. Maybe I'm just going to eat chocolate, because if you're going through this, or this is coming down the pike for you, I have understood that chocolate is one of those that won't taste very good anymore, and it's not just through therapy and the healing process, that for some people it's a permanent side effect. So go chocolate. I'm going to make a list of all the different kinds of ways that I can eat chocolate. And you know, I love donuts, so maybe the chocolate and the donut are going to have to go together. And the only thing that I'm sad about here in Houston is they apparently don't have any Krispy Kreme donut shops. I said that yesterday, because donuts are about one of my very favorite foods, and I'm sad, because I like the chocolate iced. Enough about trivial things. First week, good week. Next week, because I've had trouble the first week, my radiologist, oncologist says that that will be the honeymoon phase. My husband said he's going to miss it. But I have my daughter uploading for me a lot of different checklists that I have made. I follow a daily checklist because there are certain routines that I now follow every day. It's very important to do them, and so anyone who knows me, I make lots of lists, and I need to see it on a piece of paper where I can literally check off. It always feels so good to check things off. So I'm going to have her upload those for me. I don't know where it's going to be yet, but when she does, I'll make a video and tell you. Anyway, I guess that's it for now. So goodbye for now. Have a good weekend. I'll tell you all about my chocolate fest days, and I'll see you in the funny papers. Oh, wait a minute. My silver lining is, without a doubt, being able to spend a wonderful morning with my husband before he left. See you in the funny papers.